Hi everyone. This time the topic I choose based on my new book, Case-taking, Posology and Follow-up in Difficult Condition, like psychiatric condition, a module which needs specific whether it is acute psychiatric, chronic psychiatric, psychosomatic or somatopsychic psychiatric disease or one-sided psychiatric disease. Yeah, so I'll be talking here the 4 area-centric case-taking module with artistic unique questions and methods with psychiatric-centric specific section-oriented diary with posology in such cases. Finally, we'll end with a similimum-centric counseling in emotional cases. Cases like bipolar disorder is Stendhal syndrome and, if time permits, acute psychosis. I'll be taking you to a case-taking module in pathology, especially autoimmune disorder, where present predominant picture and persistent picture. So two state, two totality, and the case-taking module, how to explore pathology, whole state, the present state and persistent state in such cases, how to make totality, how to select posology and remedy, with focus around autoimmune disorder. This is close to my heart that recently I spoke about it in Munich, a glimpse of it, along with my teachers and my colleagues like Massimo, Yakir, Dr Sankaran, Farokh Master, and it was well appreciated. In such cases, I will also teach how to study pathology, remedies from a pathology perspective, like example, autoimmune disorder perspective. Example, if you have autoimmune disorder with autoimmunity to type, innate type, the cellular type, where let's say phagocytes are involved, then do you know remedy which directly affect the phagocytes? Like your neutrophils, basophils, eosinophils, macrophages. Each one remedy, the different remedy has different depth. Example, for phagocytosis, we have vanadium in homeopathy, which increase and decrease phagocytes. Like that, I can show you many with each one different. That way, if we study our remedies, we will have pathology center, the physiology center and understanding of the remedy, and holistic characteristic centric perspective. When they both come together, this is a real holistic understanding of a remedy. This will be all studied with autoimmune centric cases like case of vitiligo with alopecia totalis since birth, case of rheumatoid arthritis, and if time permits, Sjogren's syndrome, to demonstrate the concept, case-taking module, posology module, totality module. The next we will go to an organ transplant. In organ transplant, since the organ coming from outers, it carries its own state. So how in a patient, the concept of two-state, the concept of two-state-centric case-taking, a present predominant change state, organ state, and persistent constitutional state, and then how to make totality of both, and how to select a remedy which indicate that present state or constitutional state to help them out. In such cases, the posology and the organ-centric designer diary to give them methods, questions, so that and the advice is so that they accept the organ more and more better, and it becomes one with their own energy. Next, one-sided disease. Here I'll be focusing in one-sided disease, how to do case taking from one state, one situation, one disease centric. Yeah, exploring artistic, unique methods and questions of exploring location, sensation, modality, and concomitant. How to complete these cases. These cases generally come one-sided. So how to complete in subsequent follow-up, what to ask, and how to help them with a designer diary to help us to complete their case and move towards the similimum in such cases. One specific concept that how in such cases posology group comes up is LM1 and LM12 and mother tincture to 12C. Why? And then which one to select and which specific one to select. We will do with a specific case. Yeah. Then a module which is close to my heart with a low level of experience. People who are stuck in situations, stuck in day-to-day life, stuck in emotions, stuck in different belief system. How you do case taking? They say in such cases there is a paucity of symptom, less symptom. I don't believe. I think these are the best case and not those artistic sensation level case. These are the people, if you have proper questioning at according to where they are stuck, trust me, this will be the best cases of your life. And we are missing so much here because we think there are no questions to ask to them. But if you ask according to where they are stuck and design question, there can be hundreds of questions in this situation. Similar with the coma cases. Same concept, what to ask, how to select posology, and how to do follow-up. With a specific coma case of a hypoxic ischemia of ischemic encephalopathy with damage to basal ganglia. Then we will talk about retake. Yeah, the problem in retake is the person who is failed is also doing the retake. So the question here is how in take 2 or 3 or 4, this time I design questions and module in such a way where this time I am more close to the similimum and not just any other remedy. How I design my present case taking, how I use of the earlier failures to complete my totality. What to ask, how to ask, when to ask, how much to ask in such cases. Posology, the scientific posology, this area. Every school in homeopathy, every system in homeopathy, every method in homeopathy speak about different posology, different way of giving dose, administered dose, different way of repeating. Yeah, so here I'll be talking to you multi-dimensional holistic scientific posology where any school can understand a posology based on integrative principles where which group to select, mother tincture to 12C, LM1 to LM12, 32 mm. Yeah, which group to select, which one to give, how to repeat, when to give two posology of the same remedy together, and when to give homeopathic posology as well as other mode of the same remedy together, like Bach flower and homeopathy medicine together, and how this posology in the difficult condition, use in the difficult condition. This is the concept which I'm convinced, whether you're Hahnemanian from Boger School, Boningausen School, from Vitolka School, Shankaran School, any school, you will understand the concept well. So with all this thing, I really invite you to be part of this case-taking posology in difficult conditions, as my very close colleagues, friends, and teachers will have also expressed their unconditional desire to be part of this journey, like my very close mentor and teacher and friend, Jeremy, Massimo, Yakir, Manish Bhatia, and many other like this. Yeah, all the best, and I really look forward to meet you in this platform soon. Thank you.